Hello and welcome to Kindred OT TV. I have the beyond incredible Kim Barthel speaking with us today about neurobiology in occupational therapy practice. I'm always excited to speak with Kim. She has so much knowledge on so many topics, but I'm particularly excited to hear her share on neurobiology, not only because she is the creator and presenter of her new course, Neurobiology Matters, but also because her teachings on this topic have directly influenced and changed the way I assess and treat the children and families I work with, and also supported my own awareness of myself as an individual being and as a therapist. So welcome, Kim. It's amazing to have you back on the hot seat with me again. Before we begin, I did want to just take a moment to acknowledge the traditional custodians of the land I come to you from today, the Yaegl people, and pay my respects to elders past, present, and emerging as well.
And in kindredness, in kindred spirit, I acknowledge the land from which I'm speaking to you today, the unceded ancestral territory of the Husanich and the Coast Salish people of British Columbia here in Canada. And it's always so nice to talk to you, Lee. Thank you. Thanks for the opportunity for the conversation.
You know, I would talk to you all day, every day if I could, Kim. just keep on having Zooms all day. I love talking to you. I love you as a human, but you just teach me so much and share so much. So I'm excited that you're here. But I actually went onto Google and I wanted to see what the actual definition of, or a definition of, neurobiology is. And I'm going to read it to you, and then I'd love to hear how it lands with you, and then what it means for us as OTs, because what you read, you think, what's that got to do with OT and fine motor skills and making a cup of tea and all of these things. So the definition is: neurobiology is the study of cells of the nervous system and the organization of these cells into functional circuits that process information and mediate behavior. How does that land for you, Kim?
Wow. What it does is make me feel plugged into a light socket. Why? Listen to the key words in that definition: function of information processing and behavior, which is, in fact, what the whole course, Neurobiology Matters, is about. The backdrop of cellular structures, neural connections, and mind-body connections as they sit behind the scenes for why people do what they do and how they do what they do. So much of our clinical reasoning and our detective work looks at the surface on the outside. And that whole idea of how do we come up with behavior management strategies? Or how do I provide a solution for a client? If I understand or begin to appreciate the complexity that might sit behind the scenes and the functional implications of certain parts of the brain having any kind of interruption in their flow, it really helps me shift from immediate protocol-based thinking of what am I going to do to a greater degree of menu selections, of options of how I might approach the person's functional limitations in their lives. It makes us think of there's more than one way to come to some kind of offering in our therapeutic intervention. So I love that definition.
I guess my point was, if we read that, or someone thinks, oh, what's neurobiology with Kim Barthel? And they read that, it's so hard and for me, I'm definitely in those beginning stages of understanding and using it, like you say, from a clinical reasoning perspective. but it's very hard to be tangible on how is this course or how is knowing about neurobiology really going to help with how I treat a child in my session. So I really want to hear how you translate that. And I'm so glad you brought up about protocols, because my next question was, I think especially mostly a sole therapist throughout most of my journey, living in a regional area, you don't have a lot of, big organizations with lots of therapists in the way that some places do. So my solution to that at the time was to do courses, therapeutic listening and the sensory defensiveness course with the Wilbargers and getting kids in sync, all of these different things, which are such incredible knowledge, there's no doubt. But where I got stuck was trying to apply protocols essentially to what I was seeing, which is also fine. But it wasn't until I started to learn a little bit more about neurobiology that I understood the when and the why. So I would just love to hear your thoughts on, the when and the why, and how that, if we are, I guess, thinking from a protocol perspective, how that looks from a neurobiology lens. Sorry.
Well, you've almost answered the question in the way you asked the question.
Sorry.
Like it was it was just such a exciting insight, because I think that the tools are an incredible place to begin. Otherwise, what the heck would we know what to do at all? So we need to understand the options that can be helpful, and the finesse of knowing what to do when. That's the art form, or it seems like an art form. I think that many clinicians who transit from that new graduate space to that intermediate space find that emptiness in there of trying out their tools that they've learned with great enthusiasm, and being sometimes disillusioned or disappointed or not confident about what they've learned. And they may, in fact, take that personally. It's about them. They may abandon those skills. They may not feel confident in trying them because a previous experience might not have worked out the way that they hoped it would. And this is where that telescoping out into the bigger picture of understanding the physiology of how we are wired gives us that, I wonder how this tool fits with this kid that has the same diagnosis as this kid, but they don't look the same. They don't feel the same. They don't show up in the same way. And how do I reconcile those challenges? And when you begin to understand all of the different functions of the communication within the brain and between the brain and the body, it informs us about, okay, what I'm seeing here in this kid right now is a priority of safety and survival. And we go, what I know about the brain, based on what I'm seeing in this kid, through their face, through their voice, through their body, I just did it, that they're telling me that all of that cognitive strategy that I want to use in my toolbox, it's not the time. It's not that choice of my spokes on the bicycle wheel isn't a part of this child's life. It means that if I look at the holism of this being, there's kind of a series of equations to go from it, like a roadmap. from one place to another. And the brain, understanding the brain has really helped me with that. Knowing when I'm coming in too high, too difficult, without having enough foundation, or alternately coming in down here and not in the brainstem, and not giving the cortex enough to do, enough opportunity to participate. So that's really been how it's been very helpful in my decision-making tree as to what it is that I think I might try with the child.
It's so fascinating. And that's what I really wanted to hear and to share, because that's, you literally were just describing me, especially prior to, I guess, getting a bit more confidence and just giving things a go and reach. And for me, mentoring, having mentors who were able to supportively help me put those things together. So I love that. And when I was thinking about what I wanted to ask you, and I know you've been doing some of your own snippets, so I didn't want to reinvent the wheel, but I really wanted to make sure we were sharing some of the really cool things about neurobiology. But I've heard you talk about this a few times, where when we get the comment, and every pediatric therapist will resonate with this, you're just playing. Like, what are you actually doing? You're just playing. And I've heard you talk about how that makes you feel actually quite proud. And it's a good thing to hear, because obviously we want kids to just think it's play, but behind the scenes, your brain's just ticking over moment to moment. Can you walk me through a little bit about what your brain's ticking over about in a moment or in those sessions? What are you looking at from that neurobiology lens?
When you're an observer in a clinical setting, it's almost like a witness position. And in that wide open lens, what's happening in the clinician's brain is multiple levels of processing simultaneously. We are watching things like alignment in your trunk. What is the position of your neck? What are your eyes doing? Are you holding your breath? Are you elevating your shoulders? Are your feet flat? Can you use two hands at the same time? How do you problem solve when I offer you a new task? There is so much analysis moment to moment when we're with a child, and the child has no idea. And the parent often has no idea of all of that tracking that we're doing, right? And each piece of that data that we're processing informs us as to what we might adjust in the environment. Do I change the angle of gravity? Do I, take away the mat so it's not so cushy and you have more of a ground force reaction from the ground? Do I give you more language or less language? Do I come in and co-regulate you more? What am I seeing, and what piece of alteration do I bring in next? And only if the child perceives what they're doing as an occupation of childhood, an automatic task, will the brain code that in new learning. We know from motor learning theory, from how the brain works, that we code functions, not individual aspects of the way we process data. That our brain goes, okay, you want me to hit the tennis ball. Can you imagine if I had to break that down into every muscle I needed to use, every data, every byte of visual information, what position to hold my head? I would never, ever be able to hit a ball. So the brain codes a whole function as a unit. And play is our unit. So when we hit that sweet spot with a child and they are in joy, their brain also has more dopamine under those conditions. And what dopamine does is increase a chemical. This is another example of why neurobiology matters. When dopamine comes online, we get more BDNF. And BDNF is neurotropic growth factor, which is the chemical of neuroplasticity. That when we are having fun, when it's purposeful, meaningful, integrated, the brain chemistry lines up like a bunch of dots. And that's where all those new neural pathways evolve from. And when you explain that to a parent, then they're like, wow, this is not just, we show up and practice picking up a pencil. It puts meaning behind the why you're doing what you're doing. And then also helps them replicate that from that same space, right?
It's funny because I think if you practice picking up a pencil to the parent, that looks more therapeutic than the play without the obvious thing. I know, which I often think sometimes we make choices that don't feel aligned in therapy because we are worried about what that looks like and value for money and the doing. It's really fascinating. I'm so excited. So I have one more question, and I just want to say before I ask it, how excited I am about your Neurobiology Matters course, because like I said, it's a very emerging part of my puzzle. And I've loved all of your courses that I've attended so far. And I just learn just so much all the time. So if it's anything like your sleep matters and your feeding matters and the trauma informed and NDT and all these things, I'm just so excited that you've released this because I think it's going to be just so life-changing for therapists. So just tell me about Neurobiology Matters. Why did you create it? Who is it for? And how is it structured?
Perfect. So people who have listened to me before would know that everything that I do has the brain behind it. So I've often come at subjects, you mentioned eating and feeding matters as an example, come at subjects in the foreground and give the neurobiology in the background. I flipped it around this time because now the neurobiology is in the foreground, which is my intention is for any clinician to be able to begin to problem solve for themselves in any function. The more you know the brain, the more that filters through your practice, whether you work in mental health, in physical medicine, with children in the NICU, or elders in the elder care center. We all have a brain. And so it all comes in that weaving together in that way to allow you to problem solve irrespective of your client. I decided to break it into modules. And when I was designing the course, I thought, oh my gosh, this could be a whole year. And that is not, always applicable or appropriate or practical. So I decided to pull together concepts based on functions that I think are critical to understanding human behavior. And again, this is for anybody, like even parents who are wanting to be more informed, occupational therapists, physical therapists, speech and language pathologists, psychologists, counselors, educators. It's that brain-based thinking to inform whatever it is that you are doing in your work. So the first session is all about the chemicals. What do they do? How do they work together? Why do we need to know them? And what behaviors feed those chemicals? What do those chemicals contribute to? And what can I do to keep those chemicals in a balanced state? That's number one. Number two is the autonomic nervous system, which is about safety, fight and flight, survival, engagement, motivation, and connection. So the hierarchy of survival in the context of human relationships and how that applies to relational interventions, irrespective of who you're working with. Number 3 is about the thalamus. Thalamus is one of my favorite structures because it's like a brain within the brain that's about sensory processing. And this doesn't just belong to OTs. Counselors who work with individuals who experience dissociation from trauma, educators who are trying to teach in the classroom need to understand multiple styles of learning. And so that thalamus really helps everyone understand how different people process information at a very intermediate level in the brain and how they can modify that for the person that they see.
Mhm.
Session number 4 is about the amygdala, which is all about emotion and emotion from a place of both survival and joy and motivation and purpose, understanding the influence of the amygdala on engagement and behavior, especially challenging behavior. Module number 5 is about the basal ganglia, which is movement and refinement and novelty and being able to stay connected in attention and how movement contributes to attention, right? How if you're an educator, it can change your life knowing that the basal ganglia adds to the cortex the minute you stand up, and how you can have your student more engaged by the position of their body. So it's a valuable understanding of how to make that work for you. Number 6 is the cerebellum, which is a structure that is often misunderstood as being only about movement. Significant in mental health, significant in cognition, timing and sequencing and order and predictability and lack of predictability, very pertinent to so many functions and how we can pull them together. The insula and the anterior cingulate, which is about interoception, my inside, empathy, knowing myself, the seat of consciousness, impulse control, and what chemistry and what activity in life feeds that. And lastly, the right orbital frontal cortex, the right prefrontal cortex, the seat of attachment, and that home of impulse control, the CEO of the brain, and how relationship and co-regulation has so much power in changing that circuitry. So this integrated series, we're going to look at clinical cases. So you can say, wow, I see this in this kid. And I wonder if knowing this part of the brain contributes to that picture, it might give me something to try in my clinical practice. And that's how it's structured.
So amazing. I can hear the passion and the excitement just from your explanation of what the course is going to be about. So it's so cool. You've got so much to be proud of, Kim, with it all. I guess if anyone's wanting to, which I'm sure everyone will want to, sign up for this course, I believe you have partners in Australia with Be and Belong, and you've obviously got your own links. Do you want, I'm new to YouTube, but I'm pretty sure my son will be able to help me work out how to add the links. So if you want to quickly share how people can, sign up for the course, and I will do my very best to link it as well.
Thank you, Lee. So you can find the link to register on kimbarthel.ca under the event page. And there's a section there for neurobiology matters that will take you right to the registration. You can also find it, as you mentioned, in the Be and Belong website. And it begins, I have to know when it begins. In Australia, it's May the 15th. I want to make sure I got that right. In Australia, it begins on May the 14th. In North America, it begins on May the 13th.
That's wonderful. I'm so glad you came on and shared, Kim. It's such a motivating topic, and I always, like I said, always love hearing you speak and always learn something. So I'm going to register myself. I'm looking forward to hearing more and learning more. So thank you again for sharing on neurobiology in occupational therapy, and I'll talk to you soon, I guess.
Thank you, Lee.
You're welcome. Bye, Kim.
Take care.